Hi, my name is Dawn, and this is my Week 2 discussion post on the National Scorecard. The National Scorecard lets us know here in the United States how much of a high-performance healthcare system we have. It has 5 different indicators: healthy lives, quality, access, efficiency, and equality. As you can see from these scores, we've shown a small decrease over the last years. And then when you see the scores broken down into their individual categories, you can see where we've had decreases. We did have one increase in the quality. We went from 70 to 75, and we kind of held steady in efficiency, but the rest of the categories we did see a decrease. For this week's discussion, I chose to focus on quality indicators, which include effective care, coordinated care, safe care, and patient-centered, timely care. When quality care is delivered to patients in the hospital, readmissions to the hospitals are reduced. That is a hot topic right now. The Centers for Medicare and Medicaid Services have come up with a hospital readmission reduction program. This program is value-based and will penalize hospitals who have high rates of readmissions, therefore decreasing the payments that they will receive from them, which then is an incentive for the hospital to work on their readmission rates by implementing quality care to their patients to reduce these rehospitalizations. I specifically am going to look at the coordinated care portion of these quality indicators. Providing patients with detailed written discharge instructions is key to having a successful discharge, which is part of the coordinated care of the scorecard scoring. According to Nelson and Pulley, transitioning patients from the hospital to a non-hospital setting is when they are most vulnerable. Furthermore, they mention that fewer than 50% of patients after they are discharged will see their primary health care provider in those first 2 weeks. Many hospitals have implemented transitional care programs to aid these patients in successful hospital discharges. These programs, one such program was implemented at Mass General. This program was called the Stay Connected program, and it offered assistance with scheduling follow-up appointments for patients. Prescriptions were being filled at the hospital pharmacy and delivered to the patient prior to discharge, and home visits were made either by a case manager or a nurse practitioner after discharge. Mass General saw great success with this program in reducing their readmission rates. Not all hospitals are able to provide all of those cares due to their size and due to funding, but even just providing follow-up appointment schedule for patients and follow-up phone calls can make a difference in reducing readmission rates. My request to the Congressional Committee is to see the importance of transitional care for patients that are being discharged from the hospital. Implementing more programs like this can help reduce hospital readmissions, therefore saving the healthcare system money in the end.